right, welcome back, guys. We are right back in where we left off the last episode, and we are going to cook up some of the sand. But we also need to go grab some spruce, which may be easier said than done. We are low on food here. Oof, alright. We're a little low on food, so I'm hoping we'll be able to find some as we go. Ugh, that was painful. I do not want to eat these berries. Quit hitting me. Okay, that'll be fine. We'll eat some of these berries. I don't need to replant all of them right now. Okay. We need to go find some spruce. And we are going to take off in this direction because that is where I'm pretty sure it is, although there's a lot of jungle in the way. You know, I probably should have gotten more spruce while we were out, while we were in it, but that's okay. If it's too far away, we can maybe just go with some oak. Because there's a lot of that around here, and I'm okay with an oak floor. I want to make the rest of it out of some jungle wood. Actually, you know what? How do we feel about the andesite? A nice polished andesite floor? You know what? Let's do that. I don't really feel like adventuring all the way over today to get spruce. We don't have a ton of food after trying to go down in that cave. So let's just stay in the area, shall we? Man, we really do need to get some food. Okay, so we are going to rip up this floor. It was a good thought. Okay, come on. Give it a second. There we go. All right. My goodness. This axe does not like to chop. So, what should we talk about today? Let's just talk about, why don't we talk about mental health, right? What is mental health? What does that mean? How do we identify when we have issues with mental health? How do we identify when we need help, when we need support? What does it mean that I have a mental health disorder? Very important topics in my line of work, at least. But then again, my line of work is mental health, so of course they'd be very important topics. So essentially, mental health is a term that is used for a very broad basket of mental, emotional, social well-being things, right? So it is kind of your overall health of those items, along with pretty much anything else that doesn't fit into the lens of physical health. So, you know, physical health, we might have something like a broken bone, or what else? Like an illness of some sort, diabetes, these kinds of things that you see in mental or in physical health. Excuse me. My goodness, my clicking is just not very effective today. We are out of pick, so we need to go fix that issue. But yes, you'll see these kinds of things in physical health all the time. Mental health, on the other hand, is a little different because mental health encompasses many, many, many more items, right? It encompasses this whole basket of things that we do, things that we have around us, and can vary quite wildly from person to person in just what it means for them, right? Now, there are specific definitions for things. We do have diagnoses and things like that. How many is this? I want this to be even. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. That is not even. We'll have to do one more row. What do I want set row? This side. I want to keep that tree for now. We'll see if it stays. Oop. Okay. It's a good start. I'm going to need a lot more, but for now that's good before we head down and get more. So, mental health just kind of encompasses anything that cannot be explained by a physical health reason, right? And it does vary pretty wildly. Different people have different symptoms. Different people deal with different stressors, different causes for things. While someone may suffer depression as it relates to, let's say they have seasonal depression, so they suffer depression as it relates to basically the amount of sun that they're getting. That can be a tough one to deal with, but there it is. You know what you're working with. Some people suffer depression purely due to a chemical imbalance in the brain. Now, I would argue that this does relate to physical health, right? However, still encapsulated by that mental health lens, because it's really not as simple as just, okay, well, we need then to get more of those chemicals in your body. Sometimes it can be, most of the time not. And really, it's not a good long-term solution to just medicate. Again, this is what I would say is, for most people, this is not true, is that it's not a good long-term solution, because medications can become less effective over time. You want to get to a place where you don't have to rely on the medications. That being said, if you need the medications, if they are working for you, take them. There is no shame in taking medication. I relate it for clients to basically, fixing this imbalance in your brain, right? You are not changing your brain in a way that it is not meant to be, right? So when we talk about something like drug abuse or drug use, we're talking about changing the brain and its function in a way that it's not meant to be changed. And I want to kind of put in the caveat with that I would say it really does not matter if you want to do that. I am not trying to pass judgment on anyone for that recreational use of substances. If that is something you do, especially in a state where it may be legal to do so, go for it. I have actually in the past made recommendations to clients to try certain things just because I know that they can be helpful for some people. I've had clients, especially dealing with clients dealing with certain types of anxiety, see a great deal of relief utilizing certain substances that I shall not mention on this YouTube channel. But yeah, they can be very helpful, is what I'll say. So while I do not necessarily partake in them myself, I know that they can and are very helpful for certain people. That being said, there are a lot of things that I would say probably can get you in trouble when it comes to these types of things. That being that we know that there are certain drugs that can increase anxiety, increase depression. So it's not a one-size-fits-all approach here. You really do have to. That's not what I wanted. You really do have to make sure that you are monitoring what you're doing, because it can be more harmful than good. More harmful than helpful. That's what we'll say. I don't really like the word good. I feel like it doesn't fit for a lot of things. So yeah, it can do more harm than good, and at the end of the day, that's not what we want. We want everything, to try to help bring us some joy. So let's see, 1, 2, 3, 4, 5, 6, 7, 8 by 12. 1, 2, 3, 4, 5, 6, 7, 11, 12. Yeah. So right now we're 8 by 12. 9, 10, 11, 12. Let's start with a 12 by 12 square here. And I'm probably going to cut off the edges, the corners, but we'll see. We shall see. Only time will tell on this. Bed's coming up. So, how do you find what you may be dealing with mental health-wise, right? So, if mental health is kind of this idea of social, emotional, mental, overall, I want to use the word health, but I don't want to use the word health. It's that dynamic, right, between all of these important aspects of our lives. How do you figure out if you are in good shape, or are you in maybe not so good shape? What do you need to know? What do you need to do to figure that out? And realistically, what I would say for most people is that figuring it out is not figuring out what you have. Let's say it like this: figuring out what you have is not as important as figuring out how you're dealing with life. Ooh. Got some hiccups here. So if you can figure out how you are moving through life and are able to be okay, I think that is much more important than anything else. Okay, so we have our base here. We're going to need some doors at some point, but what I want to do is maybe add some pillars. Yeah, I'm thinking pillars. Let's just throw our bed right here for now. Pillars of what, though? I don't really want to do jungle log. I don't like the way that looks. I'm going to use this. We're going to get some oak. Where do I want to get the tree from? I don't really want to take too many trees out of our area. I like to have those trees. So we're going to head over this way a little bit. Let's see about grabbing some tree. This axe will get used up fairly quickly since it's gold, but that's okay. More watermelons. I'm gonna need them. We'll grab these real quick. Just a little bit of extra food here. We should probably at some point start a farm, get some wheat going. Among other things, we'll leave the rest here. Okay, a little bit of a forest here. Plenty of oak to go around. So yeah, the more important factor is figuring out how you are sustaining. Figuring out the positives, not necessarily putting a label on what you're going through. Because I would say that, man, I don't want to say 100% of people, but I would say probably 99% of people have dealt with some level of mental health issue, right? Now, I'm not saying a diagnosable mental health issue, because that would be kind of a different level of mental health. I am purely talking about, some level, not necessarily diagnosable, not necessarily clinical, but some level of mental health issue. And I think this is where we get kind of this large disparity in understanding around mental health as well. Because that person that deals with, let's say, non-clinical depression, so they've had a bout of depression that lasted, maybe a couple of hours, where they were, really, really depressed. They had that, they felt very sad for those couple of hours. We'll go 5 high here. They felt very depressed for those couple of hours, and then they were better. And that person's understanding of depression is not going to be the same as someone who has been dealing with depression for, years, over a year, 6 months, even someone who's been dealing with it, even just for a few days. They deal with it a few days at a time, a few days out of the year. Well, guess what? That person has a very good understanding of depression and how it impacts them and the feeling that they get, much more so than the person who didn't really have to do anything to get rid of it. They didn't struggle with it. They just, experienced it. And so, yeah, there's this kind of big difference here between those two types of people, which is why when most mental health professionals talk about depression, they talk about clinical depression, because it's a whole different animal from non-clinical depression. That's a whole different thing, and this rings true with across the spectrum of mental health disorders, right? Non-clinical anxiety is going to be a little different than clinical anxiety. It's going to feel a whole heck of a lot different, because that clinical feeling 2, 3, 4, 5. We're talking about something that's lasting days, something that's lasting a while and not going away. And this can be very, very detrimental to folks and their overall mental wellness, right? Okay, so now we've got this. I want to make kind of like a door surround. I'm going to make it out of the spruce for now. I don't know if that'll stay, but I do want to utilize a little bit of spruce here. And in fact, do I even want to keep the corners spruce? I think I want to do something else in the corners. Let's see what oak looks like in the corners here. It might be a little too light. Just looking for a little pop of color. I think that's too light. I think we're going to end up going with jungle. Let's get a little bit of that. Come on. Alright. Yeah, okay. Because we're going to build the walls with jungle wood, I have already decided. I think the next question is, what kind of doors do we want? So we'll just get a little extra wood here to see what do the jungle ones look like. I haven't seen the doors in a while. Okay, that's a decent door. I like that. Before we commit to it, what does the spruce door look like? No, I don't like that for this application. Oak. Basic oak door. Okay, I think we're going to go with the jungle door. I like the little bit of extra pizzazz it brings. Oof, it's dark. We need to sleep. Okay, so this has been a fairly constructive, get it? Constructive? Fairly constructive day. I am going to finish off said constructive day, I think, by just building this out a little bit. Whoop. Little slip there. That's okay. And we're going to get some big windows in this place too. Of course. Keep on with that misclick. Perfect. Perfect. So this is going to be a window. Everything else here, though, I think is going to Okay, now that we've got this in like this, let's take a look. How do I like that? I don't know if I like it. We might change that back to just spruce. It's the hardest part of building for me. I can never figure out what I like. Okay, let's get some glass. Let's get some glass going. And of course it doesn't want to work properly for me. That should be enough. Alright, well, if we keep doing that, it's never going to be enough, so a little more careful. Okay, decent start here. Not perfect, but we'll get there. This wall just needs to be a big window. That's what we're going to do. It's all going to be window. Big picture window. Doop. Yeah, there's an easier way to do this, isn't there? Okay, less talky, more buildy. That is what's going on right now. I'm having to concentrate a little bit more as I'm doing this, just because I really have no idea. Oh yeah, that's nice. Really have no idea what I want it to look like just yet. But I think that's what we want. This nice big picture window we can see out over there. Looks good. My thought is we're going to have our garden out here, and we're going to build more house up up the hill a little bit. So I don't think, at least for now, I don't think we need big windows here, but I'm gonna do like, I want to do this, because I think I'm gonna have this be a hallway. Yeah, let's just fill it in for now. It'll be fine. We'll come back and take it out if we need to. So yeah, there can be different levels. And what we don't want to do, this is important, is we don't want to judge other people for what they've experienced, right? We don't want to put our own judgment on people and what they're going through, because we don't know, right? When I'm working with someone, I do my best to take what they're going through at face value, right? I do not presuppose that someone might be lying, or that someone isn't telling me the truth about what they're going through, what they're experiencing, because why? Why do we have to be so cynical? I don't really understand. Actually, let's bring these inside before we go off adventuring. I really don't understand. And there are a great many cynical people out there. You know, and I don't want to sort this just yet, so we won't. There are a great many cynical people out there, and you know, that I think can come with the territory of what I would call just time under pressure. People become more cynical the more they see, sometimes, especially when those things are negative things. So someone who works with substance abuse and those types of things over time may become more cynical and less understanding because they've seen it all, they think, right? I know of a few people who, you know, they just get to a point where they're going to tell you what you need to do, and if you don't do it, well, guess what? Then you don't make it, or whatever, however they're thinking about it. And that, to me, is just such a weird, strange way to go through life, right? Why are we putting on other people the things that we think that they should do? And if they don't do those things, if they don't meet our expectations, you know, then we tell them they failed. When in reality, what we should be doing is working with them to set expectations, to look at what they can do and build off of that. And not expect people to be robots and all be the same and deal with things the same way. Because even though it may work for one person, that same solution may not work for the next. And that's about the long and the short of it on that front. So I live by, I live kind of by that idea, right? Is that solutions are not one size fits all. You cannot have a solution that works for all people. That's just how it is. Alright, we're going to put a little border around the edge here. And I'm going to leave a little bit of space for my stairs there. Everything else is going to get a nice green border here, because I think that's going to look good. Okay. Okay, but we are going to wrap it up for today. A bit of a longer episode today. Yeah, we pushed it out a little bit time-wise. Getting into mental health stuff for me can do that. But that's okay. We will let's see. We will post this. It'll be okay. Hopefully you guys are getting enough out of these episodes. I know I'm not diving in real deep on a lot of these things. At this point in time, they're just thoughts that I'm having and trying to kind of get out some what I think is important information, what I think is is stuff that's important for people to know, but maybe you already know it, maybe have other questions, and you want to, you have something specific that you want to ask. Feel free to ask questions, and I will do my best to answer as quickly as I can in an upcoming episode. But that is all for today, guys, and I will see you in the next one.